Welcome, curious minds, to the Deep Dive. You've brought us a really compelling stack of sources today. We're diving into something quite specific, but wow, really impactful in animal health. Our job, like always, is to wade through these details, pull out what matters most, and give you that, shortcut to being properly informed. Today, it's all about equine perineal injuries. Sounds technical, I know, but think mares, think foaling, and think some very delicate anatomy down there. The sources, detailed veterinary texts. They really break down these injuries, what causes them, and how they're fixed.
It's a topic that really shines a light on the challenges, the complexities that can pop up during something as natural as birth, even for animals. We'll get into the what, definitely, but also the why it matters so much for the mare's health, her comfort, and crucially, her breeding future.
Okay, so let's unpack this. The sources mention two main things, perineal lacerations and then these rectovaginal or rectovestibular fistulas. What exactly are we talking about here?
Right, so essentially, these are pretty significant traumas.
Yeah.
We're talking about the tissues between the anus and the vulva, that's the perineal body, and sometimes the wall separating the rectum from the vagina or the vestibule. And the key thing, really, is that they almost always happen because of complications during foaling. Parturition. These injuries, they can seriously affect the mare's comfort, her hygiene, and like you said, her breeding soundness down the line.
Makes sense. Now, these lacerations, our sources categorize them 3 degrees based on how deep the damage goes. Let's walk through those because the outcomes seem quite different. Okay, first degree, what does that actually look like?
So a first-degree perineal laceration is the most superficial one. It's just the skin and the mucous membrane, usually at the top of the vulva or maybe the perineal body itself. What's really important is that the anal sphincter and that wall, the rectovaginal septum, they're completely fine, intact. It often happens from just, minor trauma, maybe a fast delivery or the foal's just a bit big. Clinically, you just see some superficial tearing, maybe a little bleeding. Prognosis, excellent. No impact on future breeding, and often they don't even need surgery. They just heal up.
Okay, so relatively minor then. Good news there, but obviously it gets more serious. What about a second degree? How does that differ?
Right. With a second-degree perineal laceration, now we're seeing damage to the vaginal lining, the muscles of the perineal body, and the skin. It's deeper. But, and this is key again, like the first degree, the anal sphincter and that rectovaginal wall, still intact. This type often happens if the foal's foot, or maybe its nose, catches on the top wall of the vagina or the perineal body as it's coming out. Clinically, you'd see a definite tear, maybe a dip or depression in that perineal area. Swelling, inflammation too. Sometimes the anus looks a bit sunken. Now, connecting this to the bigger picture, a really common and significant problem here is pneumovagina. You might hear it called windsucking.
Windsucking, because air gets in.
Exactly. The seal is broken, basically. Air gets sucked into the vagina because the perineal body isn't doing its job properly anymore, and that leads to contamination, chronic uterine infections, endometritis specifically, which, really impacts fertility. Urovagina, urine pulling, can also happen. The prognosis, though, with surgery to fix it, it's generally good to very good. Fertility can usually be restored.
That makes perfect sense. Break the seal, bad stuff gets in.
Yeah.
Okay, so that leaves the third degree. Sounds like the most severe one.
It is. A third-degree perineal laceration is a complete disruption. Everything's torn through. We're talking the full thickness of that rectovaginal wall, the perineal body muscles, and the external anal sphincter. What this means, functionally, is you get a common opening between the rectum and the vaginal vestibule. The mare literally passes feces through her vulva.
Wow, okay, that's significant.
It is. It's caused by really severe trauma during foaling. Like if a foal's foot punches right through the roof of the vagina and the floor of the rectum, often happens with difficult positions like a foot nape posture. And you often see it in first-time moms, primiparous mares, which just adds to the whole situation. Clinical signs are pretty unmistakable. Feces coming from the vulva, obvious fecal contamination of the whole area. The perineum itself is just severely damaged, swollen, bruised, contaminated. Pathophysiologically, it's a total breakdown of that barrier. Chronic fecal contamination floods the vagina and uterus, causing severe endometritis. Makes the mare infertile, essentially. Plus, with the anal sphincter damage, you can get fecal incontinence too. Prognosis for breeding. It's fair to good, but it hinges entirely on successful surgical repair.
Okay, so those are the lacerations, first, second, third degree. But you mentioned fistulas too, rectovaginal or rectovestibular fistulas. How are they different from that third degree tear?
Yeah, that's a really important distinction. A rectovaginal or rectovestibular fistula is basically an abnormal hole, a direct connection between the rectum and the vagina or vestibule. The key difference from the third-degree tear is that with a fistula, the perineal body and the anal sphincter are usually still intact. Or, mostly
So
intact.
how do they form then,
Yeah.
if it's not a full tear?
Well, typically it happens when a foal's foot starts to penetrate that rectovaginal wall, but then maybe it pulls back or someone pushes it back during delivery so it doesn't tear all the way through to the outside. The tissues around that initial puncture then heal, but they leave behind this small, defined opening, the fistula. It can also happen if a third-degree repair doesn't heal perfectly or breaks down partially, the classic sign. Small amounts of feces, sometimes little fecal balls or even just gas, passing through the vulva. But from the outside, the mare's perineum might look relatively normal. Like the third-degree tears, though, it still causes that chronic fecal contamination of the reproductive tract, leading to endometritis and infertility. Our sources note rectovestibular fistulas are much more common than the rectovaginal ones. Prognosis here is generally good to fair, again, with surgical repair, usually better if the fistula is smaller.
Okay, so we have these different types of damage. How do vets actually figure out exactly what's going on? What's the diagnostic process like?
Diagnosis really comes down to a careful, thorough physical exam, often done right after foaling, or maybe they wait a bit for the initial swelling to go down. And absolutely crucial right at the start is getting a detailed history of the foaling. Was it difficult? Did someone assist? How long did it take? That context is paramount.
Okay, so history first, then the exam itself.
Yes. It starts with just looking carefully at the whole external perineal area, checking for tears, swelling, bruising, any obvious connection between the tracts. They'll also watch the mare defecate and urinate, just observe. Then a gloved hand exam is essential, gently inserting a hand into both the rectum and the vagina or vestibule. This lets the vet actually feel the rectovaginal septum, feel the extent of a tear, or palpate that opening if it's a fistula. You can often feel it from both sides.
So they can actually feel the hole in the case of a fistula.
Often, yes. And vaginoscopy helps too, using a speculum and a light source to directly see inside the vagina and vestibule. You can pinpoint the tear or fistula, see its size, maybe even see fecal material in there. For second-degree tears, checking the overall perineal conformation helps spot signs of that pneumovagina or urovagina we talked about. And sometimes uterine culture or biopsy might be done to check how bad the resulting endometritis is. But, the sources are clear. The diagnosis is usually pretty obvious from the exam. No need for fancy blood tests or imaging generally. It's also worth noting these aren't usually 5-alarm emergencies. There's time for the initial inflammation to settle before jumping into major intervention.
Right, that makes sense. So treatment, it sounds like surgery is pretty much always the answer for the more serious injuries.
That's correct, yeah. Treatment is almost always surgical. The goal is put everything back together anatomically, restore function, and hopefully preserve the mare's fertility. But here's where it gets really interesting and maybe a bit counterintuitive. The timing of the repair.
Oh, you don't just rush in and fix it.
Generally, no. Not for the second and third-degree tears or the fistulas. Acute repair, meaning right after foaling, is actually not recommended. The reason is those tissues are just too traumatized. They're bruised, swollen, often contaminated. If you try to suture them right away, the repair is very likely to fail to dehisce, is the term. The stitches just won't hold in that compromised tissue.
So you wait. How long?
Yes, the gold standard is a delayed repair, usually waiting about 3 to 8 weeks, most commonly, maybe 4 to 6 weeks after foaling. This delay gives everything time to cool down. Inflammation subsides, swelling goes down, any dead tissue sleeves off, leaving healthier tissue edges to work with. Plus, the body starts to form granulation tissue, fibrous tissue, which gives a much stronger foundation for the sutures to hold. It also, gives the mare herself time to recover from the foaling, and if she has a full nursing, they often wait until the foal is weaned.
That makes so much sense physiologically.
Yeah.
Wait for the best possible conditions for healing?
Mm.
So while waiting, what kind of care does the mare need?
Yes, the pre-surgical management, it's absolutely critical for success. Wound care is key, keeping the area as clean as possible. Daily gentle washing. They'll usually be on systemic broad-spectrum antibiotics to manage infection, and NSAIDs, non-steroidal anti-inflammatories for pain and swelling. And tetanus protection is essential. And then there's the diet. This is hugely important. Dietary modification.
What kind of diet?
A very soft, laxative diet. Think soaked hay cubes, mashes, beet pulp, maybe just pasture if it's lush. This starts several days before surgery and continues for weeks after. The whole point is to keep the feces really soft so the mare doesn't strain when she defecates, which would put tension on the fresh repair. Absolutely no dry hay, no hard grains. Sometimes they'll add oral mineral oil or bran. Green grass is great because of the high moisture content. Oh, and during the surgery itself, they often use an epidural anesthetic to stop her from straining then, too.
Wow, that pre-op care sounds almost as intensive as the surgery. Managing that diet for weeks must be a challenge. Okay, so once the time is right, how do the actual surgical repairs differ for each injury type?
It definitely requires commitment, but it really sets the stage for success. Okay, the surgeries themselves. For first-degree lacerations, like we said, surgery often isn't needed. They heal well on their own. But if the tear compromises that vulvar seal, they might do a Caslix procedure just suturing the top part of the vulvar lips together to prevent that wind-sucking, the pneumovagina. For second-degree lacerations, the surgery is called a perineoplasty. It's basically reconstructing the perineal body, rebuilding that tissue bridge between the anus and vulva. This restores the seal. And a Caslix is almost always done at the same time. Now, third-degree perineal lacerations, these require a much more complex repair. It's typically done as a single-stage procedure these days, although historically a two-stage approach was sometimes used.
Single stage meaning they fix everything at once.
Exactly. The goal is to rebuild that rectovaginal wall and the perineal body, completely separating the rectum and the vagina again. It involves careful dissection of the tissues, and then meticulously layering sutures to close the rectal side, then the vaginal side, and finally rebuilding the perineal body. Tension-free closure is key. And again, a Caslix procedure is essential afterward. And for rectovaginal vestibular fistulas, the surgery aims to close that hole. For smaller ones, they might just carefully debride the edges of the hole and suture it closed in layers. For larger fistulas, sometimes they need to use flap techniques, like borrowing a piece of the vaginal lining, a mucosal flap, to patch the hole without putting tension on the sutures. And yes, usually a Caslix follows this repair too. Post-op care for all these more serious repairs is pretty similar. Keep up that soft diet, continue antibiotics and NSAIDs, and watch very closely for any signs of complications like the repair breaking down or fecal impaction.
Okay, so after all that, after the waiting, the careful prep, the complex surgery, what's the outlook for the mare? Can she return to breeding? What's the prognosis?
Yeah, the prognosis, it really varies. Generally, it ranges from good down to guarded for future breeding. It heavily depends on how bad the initial injury was, if there were complications like severe infection, and critically, how successful that surgical repair was. For first-degree tears, prognosis is excellent, no real impact. Second-degree tears, with a successful perineoplasty and Caslix, good to very good. Fertility usually comes back once that contamination issue is fixed. Now, third-degree lacerations. Here, the prognosis is more like good to fair for breeding. The success rates for the surgery itself, the initial repair holding, are somewhere in the 70–90% range, which is pretty good, all things considered. But recurrence can happen. The repair can break down, partially or fully, or a small fistula might form later. Sometimes a second or even third surgery is needed. That said, many mares do go on to carry and deliver more foals without problems. But vets often recommend a really controlled foaling environment next time, and maybe even performing an episiotomy, a small cut, to enlarge the opening right before foaling, just to prevent it tearing again in the same spot. If the mare has chronic deep endometritis from all the contamination before the repair, or lasting incontinence, or lots of scarring, that can still affect fertility even if the repair looks good. And obviously, without surgery, the chances of breeding successfully are very, very low. And for the rectovaginal vestibular fistulas, again, it's a good to fair prognosis with successful surgery. Generally a bit better if the fistula was small and clean to start with. Recurrence is also a possibility here.
It really underscores how complex these recoveries can be. Given all that, is there anything that can actually be done to prevent these injuries from happening in the first place? Or is it just bad luck sometimes?
Prevention is tough, honestly. The best bet is really close monitoring of mares when they're foaling, especially those first-time moms. One specific thing the sources mention is, if a mare has had a Caslix procedure done previously, it absolutely must be open before she foals again. Forgetting that is a definite risk factor for causing a severe tear. But often these lacerations happen incredibly fast before anyone, even experienced attendants, can react. They really do need that skilled veterinary assessment and, expert surgical repair by someone experienced in these specific procedures.
What an incredible deep dive, really, into the complexities of these equine perineal injuries, from, the subtle differences between the degrees of tears and fistulas to that critical timing for surgery and all the meticulous care before and after. It just highlights the level of science in animal care today.
It really does. And it underscores that, just having the knowledge isn't enough. It's about understanding when and how to apply it. Despite how serious these injuries are, with the right management, the right expertise, many of these mares can return to breeding and they can live comfortable lives. It's quite remarkable, really.
It's definitely a powerful reminder of how veterinary medicine works so hard, not just to treat an injury, but to restore function, to restore that quality of life. So for you, our listener, what really stands out, maybe it's the resilience of these animals, or perhaps the incredible detail and dedication that goes into their care, even during life's most challenging moments. Think about how that precision in modern veterinary practice can genuinely change the outcome, turning what seems like a dire situation into, well, a much more hopeful future.